Today, it is with great honor and humility that I introduce our keynote speakers, who epitomize these qualities, as you will soon hear. First, I am privileged to introduce Carole Hopkins. Najem, meaning Mother Wolf, is of the Wolf clan from the Delaware First Nation of Moraviantown, Ontario. She is the mother of 4 and grandmother of 6, which I can hardly believe. Carole is the executive director of the National Native Addictions Partnership Foundation, an organization that supports Canada's First Nations addictions programs. Before this, Carole worked at the Nimki Nipikwawongan Health Healing Center, a youth solvent abuse treatment center founded on Indigenous culture and lifeways, where she served as the founding director for 13 years. Carole was the co-chair, First Nations Addictions Advisory Panel, developing a renewal framework for the National Native Alcohol and Drug Abuse and the Youth Solvent Abuse programs. Carole now co-chairs its leadership team, mandated to implement the renewal framework. This process is a partnership between the Assembly of First Nations, National Native Addictions Partnership Foundation, and First Nations and Inuit Health Branch of Health Canada. Carole's work in the field of addictions also included serving as the chairperson of the National Youth Solvent Addiction Committee from 2000 to 2007. This national committee has maintained a partnership with many groups to develop best practice guidelines for culturally based inhalant abuse treatment. Carole has represented First Nations clients on the board of directors of the Canadian Council for Health Services Accreditation, now known as Accreditation Canada, and in this role, she was involved in the development of the accreditation program and standards. She was also a surveyor for this group in both the mainstream healthcare system within Canada and First Nations community health and addiction organizations. Her ability to blend Western and Native traditional health and healing practices is outstanding. Carole has taught in numerous post-secondary institutes, including Anishinaabe Education Institute, the Native Social Work Program at Laurentian University, and currently as a professor in the Social Work Program at King's University College of the University of Western Ontario. She holds a Master's of Social Work degree from the University of Toronto. In recognition of the outstanding work that she has done, in the field of social work and First Nations, Carole has received the well-deserved Walter Dieter Award from the Assembly of First Nations. In 2017, she also received the Order of Canada. Carole has made numerous presentations nationally and internationally to Indigenous audiences, government, healthcare professionals, and to academic audiences. And now we have the great good fortune to have her present to us. And I turn the floor over to the amazing Carole Hopkins.
Bueno, bonjour. No jem indígena cause gaye mayin gana dodem lani lanape kwe and dao medewana kwe and dao. I'm joining you today from the Delaware Nation at Moraviantown in southwestern Ontario, and I'm honored to have received this invitation to share some words with you today. I'm going to be talking about First Nations in terms of redefining healthcare, and I have one key message, and it's about our worldview. And I'm just trying to see how to make these slides go forward. Always a challenge when you can't find your mouse. Here we are. Okay, so I want to start off by sharing with you that our stories of creation, First Nations people have many cultures across this land, and our culture is defined by our language, our connection to land, and our knowledge of our stories of creation. And this goes back to before there was anything physical in this world. That's where the stories of creation begin. And one central truth across all of the different cultures is that the Creator thought of everything that we would need in creation forever and all time. And so what that means to us is that no matter what we face, that there's always an answer, and that we have to seek out what that answer is. And there's many patterns that continue to repeat across time. And we talk about those patterns as our evidence base. We can continue to rely on those patterns to inform the way we think, such as the moon was a great teacher about patterns, a great teacher about change, because she follows the same consistent pattern in the sky every single night across the months. She continues to show her presence and is a great teacher about change. And so we're in that time of change where First Nations people are sounding their voices about how they experience healthcare. Unfortunately, more recently, those stories are the stories about pain and suffering of the systemic racism that First Nations people have seen. They're tragic stories. That's why I say unfortunately. But fortunately, those voices are being heard. We know in the healthcare systems that there are various avenues to lodge complaints, to speak to the substandard care, but not often are those voices heard or responded to. And so one of the things that is critically important for First Nations is that our values, our way of being is informed by our understanding of who we are as a people in this country. And so that's why I'm starting off with this presentation about our worldview. We also know that what was given to us by the Creator, and it's embedded in our stories of creation, is our language. Every being in creation was given a language, and that language is our medicine. So just like all of the animals, all of the winds, all of the trees, they have their own sound. We as people of this land were given our own sound. And so across the country, there are many First Nations languages that inform their way of thinking and their way of being. And a constant and continuous foundation that ties us all together in the same understanding is that our language is the key to our medicine. And so on the slide in front of you, I have a picture of a drum. The drum is what connects us to our heartbeat, and that ignites a connection to our spirit and a connection to the Creator, the Great Spirit. And the way we connect is through that sound, but it's also through our language. That's a huge concept to try and understand. But when you think about receiving healthcare, in some regions of Canada, First Nations people, Inuit people, or Métis people, all they speak, their first language, is their original sound, is their original language. And then when they enter the healthcare system, they're not always able to receive healthcare in their language, in their first language. And so there's a translation. That translation requires the support of family members or people from their culture that can help ensure make certain that what is being communicated across the healthcare system specific to their needs is understood. So language is a critical medicine. And our knowledge systems as Indigenous people, we have a way of knowing. And so our stories of creation are not of the past, something that happened a long time ago, or a myth that is told to entertain our children. Our stories of creation are the foundation of all of our knowledge systems, including our understanding of medicine, including the understanding of the physiology of the human being. And so our knowledge systems are still intact. They have not ever gone away completely. Even through colonization, while they were silent, they never went away completely. And so we still can draw on them to inform our way of being and our way of practicing medicine. We're in this time now, and I'm so thankful for this invitation to be speaking to you today, because we have to embrace, if we are going to create change, we have to embrace and participate collectively in the decolonization of Indigenous knowledge. The epistemic racism, which is the judgment and valuing of which knowledge is more credible. And unfortunately, in our history, Indigenous knowledge has been silenced because our language was silenced through legislation that we know as the Indian Act, through the residential school system. And so as that language was silent, our knowledge became silent. It didn't go away, didn't disappear, but it was silenced. And so that led to the colonization of our knowledge, the belief that it's just fictitious stories, and that is not the truth. Our knowledge base also has a strong foundation of evidence. So we have to think about what is decolonization of knowledge and how do we include Indigenous knowledge as evidence. It takes, everybody is talking about cultural competency, cultural humility, and cultural safety. And that is a conversation that challenges us to question, to be aware of, to learn about our own values, our own education processes that led us on our journey of the professions that we have chosen, so that we can begin to find space for understanding what might be ambiguous, might not be well understood. And we can create a pathway to our future that is appreciative of differences, appreciative of similarities, and that we can learn to straddle that road in a way that supports differences. We're a country in Canada with many different nations of people, with many different ways of understanding. And I'm going to share with you now an example of that knowledge and that evidence. And so our story of creation, it starts talking about the star galaxy. And again, based on those patterns of evidence that is within our knowledge base, when we talk about the star galaxy, talks also about the imprint of our languages, the imprint of our knowledge. And it talks about the imprint within us as human beings of what was created by the Great Spirit. And so we understand that what we see in the star galaxy is also the same imprint within us. So in this slide, I'm talking specifically about the neuron cells. So there's language that helps us to validate our knowledge and understanding. And so this word that is in Ojibwe is monodomenes, is spirit seeds. That's the translation, loose translation in English is spirit seeds. And when we look at the history of that concept, because it's not just a word, it's a full concept. And so what does spirit seeds mean? It goes back to an understanding of our genetic makeup, our DNA. And it has a physical property as well as a spiritual property. And that spiritual property is all about our identity. It gives purpose to where we come from, our connection to the land. And so it builds an understanding, a foundation for understanding that we do not exist just individually. In the healthcare system in COVID-19, we have to be very careful about the traffic through healthcare systems to protect the healthcare workforce, but also the people who are seeking healing and treatment and care for the healthcare needs. But because of the systemic racism as one issue, but also because of the values that we have in connection, there are many stories about how healthcare systems have adapted over time to ensure that First Nations people continue to have connection to family, continue to have connection to land. So just as an example, an older man in a remote region of Canada was in his latter stages of life, and he wanted to be connected to the land, but he was connected to all kinds of machines to support his life. And so his family was able to talk about those values, talk about how critically important it was for him to be connected to the land. And they set up a miner's tent outside of the hospital, was able to move some of the machinery that he needed, and he was able to receive the healthcare he needed, as well as access to his culture and what was meaningful to him in that tent outside of the hospital on hospital property. There are other healthcare settings that have a sweat lodge on the hospital or the acute care property. In this example, applying that understanding about monodominus, the spirit seeds, I want to tell you a story about my grandson. When he was coming into this world, he was in a big rush. And so he was born way too early. He had to spend time in the hospital for a couple of months until he was ready to come home. But when he came home, what was really important was to connect him to the land. And so in this picture, what you see is his mother holding him as a brand new infant, and he was lowered and connected to the earth. What's not in this picture are all of the family that are around him, celebrating his arrival and his connection to the earth, so that he always knows where he comes from and that he can be continued to be nurtured by the environment around him. And the way we dress our children is also reflective of that. So he's in his Tikanagan, and on the side of his Tikanagan is his clan family. Our clans are our connection to the earth, critically important for our health and wellness, mentally, emotionally, physically, and spiritually. And then the way that we dress up our children is the same as dressing up those spirit seeds of life. And so in the healthcare system, how do we help dress up the seeds of life? We oftentimes are only focused on the sickness and the what's wrong with you. And we need to be also concerned more holistically about the total environment and the connection that people have that support their wellness, their health. And so we have many stories that have been passed on from generation to generation about how we ensure life. You know, thank goodness he was in my daughter and was able to get to a good hospital where she was provided excellent care while she was struggling with the birth of her firstborn. But while they were in the hospital, we were out on the land performing those ceremonies that we needed to do to ensure that he would arrive into this world safely. And so why am I telling you all of this? Because we require many partners and many alliances, and we can put our hands together to hold that light that is life. And we can ensure that First Nations people, Inuit people, Métis people are appreciated, that they're understood, that all of Canada understands that we have a right to health. We have a right to safe health care. We have a right to be treated with dignity and respect. And the more we share that story, not in a challenging way, but as a matter of human being, that we are human beings supporting other human beings, that we think about the Indigenous people of this land and we recognize their importance, their critical importance to the fabric of society, that comes from the land. We can put our hands together and learn how to work together in that way. So like the birds in our story of creation, the birds are the ones that carry the seeds of life, and they spread that everywhere. And everywhere life grows because of their work. And so I invite you to carry these seeds, whatever it is that stood out for you, one piece maybe, What does that mean? Continue thinking about it. Share it with others. Spread the seeds. And just like the eagles, they don't typically flock together, but they do at certain times. And we recognize the eagles as the chiefs, the leaders. They're the birds that can fly the highest. So whenever you see the birds in the atmosphere in the sky, you look at them and they can only go so far, and then they come back and they fly around. But the eagle is the one that can fly the highest, and it can fly to its completely out of sight. And those are our teachers about leadership. And so invite all of you to carry these seeds, but invite you also to discover your own leadership. Don't be shy to learn about and to stand up and voice your support for Indigenous people in Canada. And when we do that, when we start having that conversation in very respectful ways, then we start to see the space that relates. And so this concept of the space that relates is also linked to our stories of creation, that the Creator, the Great Spirit, gave to every being their own road in life. And when we know about what's on our own road, then we have more space to have respect for what is on the other's road, our road in life. And it sheds light and helps us to understand and appreciate others. So I invite you to carry those seeds, to carry the alliance with Indigenous people in Canada to create a good future. Miigwech.